Welcome back to Minority Med Project, where we discuss minority health, representation in medicine, and the issues shaping healthcare in our communities. Today, we are diving into a concept that sits at the very heart of patient advocacy and care: health literacy. Health literacy is more than just being able to read a pamphlet in a doctor's waiting room. It is the ability to find, understand, and use health information and services to make informed decisions about your body and your care. From understanding complex medical jargon and dosage instructions to navigating health insurance and knowing when to seek emergency care, healthy, health literacy touches every single step of the healthcare journey. Across the United States, limited health literacy is a widespread issue, but but it disproportionately impacts minority communities, non-English speakers, older adults, and low-income individuals. When health information is overly complex or poorly communicated, the consequences can be serious. Patients with lower health literacy are statistically more likely to misinterpret medication schedules, skip preventative screenings, experience higher rates of hospitalization, and manage chronic conditions like diabetes or hypertension less effectively. So, why does this gap exist and why is it so pronounced in minority communities? First, the medical system itself is overwhelmingly complex. Healthcare providers often rely on medical jargon, terms like hypertension instead of high blood pressure, or benign instead of harmless. When doctors are rushed, they may assume a patient understands these terms, leaving the patient too uncomfortable or intimidated to ask for clarification. Second, the language and cultural barriers play a major role. For millions of people in the US who speak English as a second language, receiving medical form discharge papers or prescription bottles printed only in English creates an immediate barrier to safe care. Even when language is not a factor, health materials rarely account for cultural norms, diet, or lived experiences, making advice feel impractical or disconnected from a patient's daily life. Finally, systemic educational and economic inequality contribute directly to health literacy levels. When communities lack access to quality science education or relatable health resources, navigating modern medicine becomes significantly more challenging. Improving health literacy is not just the responsibility of the patient, it is primarily the responsibility of the healthcare system to communicate clearly. Healthcare providers can bridge this gap by adopting simple, effective strategies. One powerful tool is the Teach Back method, where providers ask patients to explain in their own words what they need to do, ensuring complete understanding before they leave the clinic. Hospitals and clinics must also invest in certified medical interpreters offering plain language translated materials and hire staff from diverse backgrounds who reflect the communities they serve. For patients and families, building health literacy starts with empowerment. Never hesitate to ask your doctor to slow down, explain a term, or write instructions down. Asking simple questions what is my main problem and what I need to do about it can transform a routine visit into a clear action plan. When health information is clear, accessible, and culturally relevant, patients are empowered to take control of their well-being, leading to better outcomes for entire communities. Thank you for listening to Minority Med Project. Join us next time as we continue exploring the topics that shape minority health and the future of medicine.